Hi, and welcome to the first episode of the St Wolfston Surgery DocCast. This is the St Wolfston Surgery take on the podcast, and we're hoping to be able to give you some information about what's going on in the practice, and also we'll be covering some topics that hopefully you'll find useful. So today we're going to have, first of all, an update of the practice, and second of all, we're going to be talking about prostates, a topic that's been particularly hot in the press recently, given King Charles's recent admission to a private hospital to undergo treatment for a prostate problem. So we thought it might be useful just to go through some of the symptoms of a prostate problem to be aware of, when to see your GP, and what the GP might well do about it. So first of all, a few updates from the practice. We're really sorry to say goodbye to Tricia, who's our lead practice nurse, who is now retiring. She'll be leaving us at the end of January. We are really lucky to have recruited two really great nurses, both of which we're hoping will be starting in February. First of all, we're welcoming Bethany. So Bethany will be joining us early February, and hopefully you'll be able to see her at the practice. The second new appointment we'll be making imminently is a new GP, Dr. Katie Lufter. She'll be joining us working 3 days a week, ensuring that we're offering even more GP capacity at the practice to ensure that we can keep offering and keep maintaining our really high quality service. She's absolutely lovely, and I'm sure you'll be looking forward to seeing her as and when you need to. Now, those are the couple of bits and pieces from the practice, but we're going to move on to talk about prostates. Like I said before, prostates are something we often get asked about as GPs and are a really important men's health issue to be aware of. Now, when to think about a prostate problem? Prostate problems generally affect men over the age of 50. They're often caused by the enlargement of the prostate gland, which is a donut-like structure which surrounds the urethra, which is the tube that passes urine out of the body. As the prostate enlarges, that donut structure enlarges and causes some pressure on the urethra that lays within it. And as that happens, we get symptoms associated with passing water. Those symptoms could involve a reduced flow of urine, so it comes out much more slowly and takes longer to empty the bladder. They might involve going to the toilet to pass urine more frequently, or more urgency in passing urine. Often people might suffer symptoms of waking up in the middle of the night to pass urine, and sometimes there might be some dribbling that happens after passing urine as well. We also sometimes notice symptoms of hesitancy, which is when you go to the toilet to pass urine and it takes some time to pass, and sometimes erectile dysfunction symptoms can be a sign of an underlying prostate problem. Now, the two main conditions that cause enlargement of the prostate are something we call BPH, or benign prostatic hyperplasia, which is a natural enlargement of the prostate, which occurs in any man. The prostate enlarges according to exposure to testosterone. So the older we are, the more testosterone we've been subject to in our lives, the larger that prostate becomes. But the other condition, which is more of a concern, is prostate cancer. And that's the thing that people generally are obviously worried about when they have these waterwork symptoms. Now, the two symptoms are quite hard to tell apart the two conditions are quite hard to tell apart just on the symptoms alone. So we generally recommend that when a male suffers those symptoms, they see their GP. The GP will listen to the story, and then the GP is likely to do several tests. The first test a GP will do to try and distinguish from these conditions is a physical examination of the prostate. That, unfortunately, is a finger into the back passage to feel the prostate itself. And don't worry, it's something we do all of the time. It's a very routine thing. It takes less than a minute to do, but we're able to feel the prostate to identify any problems physically with the prostate. And that might be we're feeling for any lumps, bumps, nodules, any firmness of the prostate gland itself. That's the first thing we do. And the second thing we do is often a blood test. And the blood test can check for a couple of things, but the thing that you're probably most aware of is the PSA blood test. PSA blood tests are not sensitive enough to be done on the entire population as a screening test. So you can have prostate cancer but have a normal PSA, and you can have no cancer and have a high PSA. So it's not that sort of sensitive enough to be able to tell the two apart. But it's something that we do because it's a useful piece of information. The other thing we might do in a blood test is check for diabetes as well, because diabetes can sometimes cause similar symptoms, particularly of passing urine more often. So once we've done the blood test and we've done the physical examination, we've got more of an idea of whether prostate cancer is something we need to consider. And if it is something we need to consider, we'll normally refer off to a urologist, and the urologist will normally see patients within 2 weeks to better ascertain whether there could be a prostate cancer there or not. If all of those investigations don't yield anything worrying, then this is much more consistent with the condition we call BPH. And BPH can be treated with medication, and there are a couple of medicines that we can consider using. But we also recommend lifestyle measures as well, because anyone who's consuming higher levels of caffeine, for example, are more likely to have problems with the waterworks. And things like sort of avoiding drinks before bed or in the evening can also help reduce symptoms, particularly nighttime symptoms that someone might be suffering with. So hopefully that's a little succinct update on prostates, when to see a GP, what you can expect when you do see a GP, and the test that we do, and hopefully you found that useful enough. Thank you very much for listening to this episode. We will be back again very soon for another episode where we hope to bring you more information on any changes that are going on within the practice and more health and lifestyle advice. Okay, many thanks for listening.